Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, I'm going to be answering some of the most commonly asked and commonly searched for pregnancy questions. So let's get into them. Yes, you can drink coffee while you're pregnant. Obviously, decaf would be more ideal, but if you do drink a caffeinated coffee, you want to limit it to around 2 cups per day. That's kind of like a safe amount of caffeine to have. And if you drink other caffeinated beverages, pop or soda, however you want to call it, teas, things like that, be sure to read the label at the caffeine concentration so that you know how much is in each thing. So like, for example, a Mountain Dew is the equivalent of like 2 cups of coffee. So 1 can of Mountain Dew is 2 cups of coffee. So think about that sort of thing when you're thinking about your caffeine intake, because babies can get addicted to caffeine in the womb. I've seen that. I've seen babies be born addicted to caffeine, and they do actually go through withdrawals, which, nobody wants our babies to go through withdrawals. So if you can, no caffeine, but if you can't, try to limit it. 2 cups of coffee a day, 1 pop a day, that kind of thing. You can feel the baby move anywhere between 14 weeks at the earliest and 25 weeks. If you are a first-time mom, this is your first pregnancy, it's probably going to be a little bit later, so in like the 20 to 25 week range, because you've never felt that sensation before. If you've had babies in the past and you're a little bit more familiar with this feeling, it could be a little bit earlier, around that 14-week mark. And if you're not sure, like, what does it feel like? It almost feels like a little bit of like fluttering, like butterflies in your stomach. Yes, it is safe. It is not a live vaccine, so it can't hurt you and it can't hurt the baby. And in fact, we encourage you to get your flu shot. Yes, there are actually a variety of medications that are over the counter that are considered safe during pregnancy. And most pregnant women want to get these medications to deal with those common pregnancy discomforts. So if you're having any sort of pain, like back pain or round ligament pain, Tylenol is going to be your medication of choice. So make sure that it is Tylenol or the generic acetaminophen, and it is not Motrin, Advil, ibuprofen. Those are not the same, and you want to make sure you're not taking those because it's not safe. Also not safe for pain is aspirin. So pregnant women should never take aspirin. You want to take acetaminophen, Tylenol, that's what you take for pain. When it comes to allergies, Zyrtec is considered safe. If you're having issues with like constipation, which is actually quite normal during pregnancy, most over-the-counter stool softeners are considered safe. An example of this would be like a Colace. And then if you're having, heartburn, which is also quite common during pregnancy, taking Tums is considered safe. No, not technically. So pregnancy tests, the way they work is they detect something called HCG in your urine. And there are other reasons aside from pregnancy where you would have HCG found in your urine. So if you do take a pregnancy test and it is positive, you want to make sure to make an appointment with your doctor so that you can get an ultrasound to confirm or rule out the pregnancy. How common are false positives? Not very common. Much more common are false negatives. And a lot of the reasons people have false negatives is they tested too soon and there's not enough HCG in their urine to detect. So if that's the case, I would wait a couple days and test again. If you are a normal, healthy weight, not overweight or underweight, we recommend 25 to 35 pound weight gain total. So in that first trimester, you'll probably gain about 3 to 4 pounds. At this stage, you don't really look pregnant. But then after that, each week you should gain about 1 pound. So near the end, that would be 25 to 35 pounds. I know we've all heard that, right? But actually, you're not. You're not eating for 2. You really only need to increase your calories by about 300 extra calories a day. So that could be just like, an additional sandwich or maybe a bowl of soup or something like that extra a day. Cravings happen for a variety of reasons. It's the hormonal shift, the heightened sense of taste and smell, Or maybe your body is telling you that it's deficient in some area. For example, a lot of pregnant women crave ice cream, right? And it's because their body is saying like, hey, we need more calcium. So those are some reasons people have cravings. They're very, very normal. Not normal is craving something that isn't food. So if you're craving something like soil or cotton balls or things like that, you don't want to eat those things. And you actually want to tell your doctor that this is happening. It can be very dangerous for you to eat those sorts of things. And oftentimes you're replacing real food with that kind of stuff, and that's not safe. Yes and no. Certain kinds of exercises are definitely not safe during pregnancy. So anything where something is going to be thrown at you like a ball, or where you could potentially like run into another person and fall down and get hurt, those are not safe. Like contact sports, you don't want to do that kind of like exercise, lifting heavy weights, that kind of stuff while you're pregnant. Lots of other things though are safe. Walking, swimming, yoga, stretching, all of those things are considered safe during pregnancy. The two big ways you can help to prevent stretch marks are to keep that area hydrated, so your skin using the bio oil or the cocoa butter or the lotions, whatever it is you got, use it, keep that skin hydrated. And also gain weight slowly and in a safe manner. Don't gain too much weight. You want to gain the recommended amount for your BMI, and you want to gain it, in that 1 pound a week manner. That's the safest way to do it. Some things that you really don't have a lot of control over, your genetics. So stretch marks are genetic. If your mom had stretch marks, there is a higher possibility that you will too. If you have more than one baby, right? So if you're pregnant with twins or triplets or quads or whatever, you are more likely to have stretch marks than somebody who's pregnant with just one baby. And there's another condition called polyhydramnios, which is where you have a larger than normal amount of amniotic fluid. This causes the stretching of the uterus, so your belly gets a little bit bigger, a little bit faster, and you're more likely to have stretch marks with that. And unfortunately, a lot of these things we don't have a lot of control over. I wish I had some great miracle cure for you, like here, just use this and it's fine and it'll never happen to you. But that's not the case. So the best things to do, hydrate that area and try to gain a healthy amount of weight over time. Yes, most people can have sex, a normal healthy sex life while they're pregnant. A couple of reasons why you might not be able to. If your water is broken, right, you should never have sex after your water breaks because you're at high risk for infection. If you're bleeding at all, we should never have sex if we're bleeding. If it's causing you any sort of pain or discomfort, you should stop and call your doctor and let them know. And if you're on bed rest or pelvic rest because of, a complication like a premature labor or something like that, you definitely should not have sex. But if you don't have any of that stuff going on and everything is kind of normal and healthy and good, then it's perfectly safe. Yes, for most women who have, no complications or anything like that, it is considered okay to travel up until 36 weeks. Now, some things to keep in mind if you are going to travel. Knowing where you're going, knowing the location, and knowing where you can find the quickest route to the nearest hospital in that location, just in case something happens. And then after that 36-week mark, you want to stay pretty close to home. You want to stay within a 2-hour radius of your hospital that you plan on delivering at, just in case. Yes, it is okay for you to carry your toddler while you're pregnant, as long as you don't have any other complications going on or you haven't been put on any sort of restrictions by your physician. It's totally fine. And it's actually really normal. At this stage, they get really, really attached to you because they know something's happening. They might not understand it, but they know something's happening and they want a lot of attention from mommy. So it is okay to carry your toddler. Do be safe though, because sometimes they can get a little wild and they can accidentally punch and kick your belly and stuff like that. Most of the time if they do that, it's not going to be a big deal. It's not going to cause harm to the baby. If it does happen and you are concerned, make sure to call your provider. So that was my video answering the most commonly asked pregnancy questions. Is there a question that you have that I didn't answer? Go ahead and put it in the comments below and let me know, and maybe I'll make another one of these videos. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.